For a child with muscle tone problems, having a bath can be stressful. Getting cold, postural insecurity, that is, feeling unstable or not well supported, excitement for children who like baths, and fear or distress for children who don't, can cause many children to startle or move unexpectedly and increase high muscle tone. It's important to remember and follow all of the basic safe handling techniques when getting a child in and out of the tub. Because the child will be wet and slippery, it's also extremely important to make sure that the child is securely positioned while in the bathtub. A bath seat will be needed if there's any risk that the child can't sit safely in the bath. There are many different styles of bath seats available. Some provide full body and head support, like the one Julia is demonstrating here. Others provide trunk support only, like this one here. Planning will help everything go smoothly. Be sure that you have enough time for the bath and you feel confident in what you're going to do. When you're relaxed, the child will be able to relax as well. Make sure you have the equipment you need for lifting and transferring before you begin, as well as a well-fitting bath seat if needed. Especially if the child has high muscle tone, keep the child warm before, during, and after the bath. Have the bath water ready before you undress the child. If there's a delay after the child is undressed, be sure he or she is covered with warm, dry towels or blankets. If you're using a bath seat, much of the child's body will not be under the water. Keeping the room warm and the bath as short as possible without rushing will help keep the child from getting too cold. When it is time to get the child into the bath, gently ease the child into the bath seat or water. Make sure you are well positioned, as the child may startle upon entry. Position the child in the bath seat so that he or she is sitting evenly with his or her head facing forward. Check that the straps are snug and securely fastened. When finished, drain the water and wrap the child in a towel before lifting him or her out of the tub. By getting rid of the water and having the child partly dry and well wrapped before the lift, you minimize the risk of slipping. If the child has high muscle tone, use the techniques already discussed that minimize tone. If the child has low muscle tone, follow the safe handling basics to help protect the child. To safely place a toddler or small child in the tub, especially if he or she has low muscle tone or is awkward to hold safely, wrap the child in a large towel first, the way that you would bundle a baby, except that you don't need to cover the child's feet. Wrapping the child like this will help protect his or her arms during the move and keep the child warm. Unwrap the child once he or she is in the bath seat and securely do up all the straps. If you don't have the right equipment, don't have enough people to help, or are unsure of how to safely get a child in and out of the tub, change your plan and give the child a bed or sponge bath. It is always best to err on the side of caution. When giving a bed or sponge bath, remember to keep the child well positioned. Use rolls or pillows to get the child in a nice flexed posture, just as you do for positioning a child in bed. Protect the pillows or other supports with soaker pads or towels over a waterproof sheet. Warmth is still important. Keep as much of the child as you can covered with a towel or blanket and dry each body part as soon as it's washed. Wherever you're bathing a child or teen with high muscle tone, cleaning inside the hand can sometimes be a special challenge, as many children with high muscle tone will keep one or both hands closed in a fist much of the time. To safely open and clean a fisted hand, ensure the child is comfortable and well supported, and have everything ready for washing and drying the hand before you begin to open it. Briskly brush the top of the child's forearm with your fingers. This helps activate the muscles that straighten the fingers. Then rotate the forearm and hand to a palm-up position. Sometimes this is enough to allow the hand to open on its own. For a hand that doesn't open as easily, slip your index finger into the child's palm and gently ease the thumb out. Notice how slowly the therapist is moving, allowing the thumb to come out at its own pace rather than forcing it. Once the thumb is out, hold it away from the palm of the hand and gently uncurl the fingers. Rotate the palm up, if you haven't already, to help keep the hand open. Keep your hand in contact with the back of the child's hand and fingers as you open, wash, and dry the child's hand. Never forcefully pull on the child's fingers to open the hand. This will only make the muscles tighter and increase the risk of injury. Use these same hand opening techniques when you need to put a hand splint on a child.